Brooke Sharpless. I'm Mrs. Friend's sister, and these are my classmates, Abby and Brittany. This video will include demonstrations of different techniques you can use at home to try to improve your child's oral health care. Special needs kids are more at risk to develop gum disease, cavities, and dry mouth. Hopefully these tips will reduce your child's risk to develop these oral health problems.
To start off, we are going to show you a few easy ways to position your child to help with brushing at home. These are the same techniques that were described in the brochure.
The first technique involves standing in the bathroom. Stand behind the child while the child is facing the bathroom mirror. Have the child tilt their head backward. The second technique is called sitting on the floor. Sit in a chair with the child sitting on the floor in front of you. Have the child lean against your knees. If necessary, you can gently place your legs over the child's arms and legs to keep them still. The final technique is called laying down. Sit on the floor with the pillow in your lap. Have the child lay down with their head on the pillow. The techniques we demonstrated should help improve accessibility while brushing your child's teeth at home. Next, we will demonstrate how to angulate a toothbrush properly in their mouth. To start off, place a pea size of toothpaste on the bristles of the brush. If your child is unable to spit, a smear of toothpaste is okay. When choosing a toothpaste, make sure you look for something that has an active ingredient of fluoride. To start off, place the toothbrush at a 45-degree angle to your child's gums. You can do this by placing the toothbrush flat against the crown of the tooth and then angling it upward or downward slightly towards the gum line. Brush gently in a circular motion. Make sure you brush the outer, inner, and chewing surfaces of each tooth. You can use the tip of the brush for the inner surfaces of the front teeth. Be sure to brush twice a day for 2 minutes each. Some other important things to know are to always use a soft bristled toothbrush. Medium and hard bristled toothbrushes can cause trauma to the gum tissue and to the teeth. Also, after your child spits out the toothpaste, never have them rinse with water. It's important for the fluoride in the toothpaste to sit on your child's teeth for at least 30 minutes. If your child prefers to rinse with something after brushing and is capable of completely spitting all of the rinse out, then you can use a fluoridated mouth rinse.
Next, we will demonstrate the proper flossing technique.
To begin, start by getting 12 to 18 inches of floss. Wrap the floss around the middle fingers on each hand. Grab the floss with your index fingers and your thumbs. Gently glide the floss in between each tooth by making a seesaw motion. Once you reach the base, make a C shape around each tooth. Go up and down a few times in the C shape. Make sure you floss the back of the very last tooth. Sometimes flossing can be easier by using a floss aid such as the one Brittany's holding. When using a floss aid, use the same C-shaped technique. When you're all done, dispose of the disposable head and pop a refill on the next time you're ready to floss. The final thing that we want to talk to you about is your child's diet. Diet plays a huge role in your child's oral health. Sugary drinks and foods act as a food source for bacteria and can lead to cavities. The recommended juice intake for a child over the age of 2 years old is 6 ounces. This is an example of what 6 ounces is. And the recommended water intake for kids over the age of 2 is 6 to 8 glasses. This is an example of 1 glass, 8 ounces. We would like to encourage you guys to try to start replacing 1 glass of juice with a glass of water each day.
Some examples of some things your kids might like to eat. There's like a lot of sugar and a lot of things that your kids eat, which is bad for your teeth because it can cause decay. So in a brownie, 2-inch square brownie, there's this much sugar in it. In a Hershey's bar, that's 1.55 ounce, which is just like the size down from a king size. There's this much sugar, which is a lot. If your kid has 1 cup of vanilla ice cream, there's about this much sugar in it. If your kid has a 3-inch chocolate chip cookie, there's about this much sugar in the 3-inch chocolate chip cookie. And finally, if your kid has 12 ounces of soda pop, there is this much sugar in it. So just a couple tips that we found on Choose My Plate to better your kid's diet. Balanced calories, enjoy your food but eat less and avoid oversized portions. Eat more fruits and vegetables, more specifically make half of your plate fruits and vegetables for each meal. Switch to fat-free or low-fat 1% milk. Make half your grains whole grains. And like Brooke said earlier, drink water instead of sugary drinks like soda, Kool-Aid, juice. It's really important to replace those sugary drinks with water so that it's not affecting your kid's health or teeth.
Thank you for watching our video presentation. We hope that you found these tips helpful. In conclusion, I just want to remind you how important it is to make sure that your child is maintaining regular 6-month dental visits. In the brochure that we sent home with your child, you can find information about Nysonger, a dental clinic that specializes in care for special needs children.